Are you looking for a more natural way to sleep with low back pain? Or would you like to get a better night's sleep, but you suffer with low back pain that maybe wakes you up in the middle of the night or maybe causes you to wake up with a stiff, achy back? And you're looking for some natural techniques because you're tired of taking pain medication and surgery is not an option for you. Well, friends, then you are in the right place today because we are talking about 5 holistic tips that you can implement right now to decrease your back pain with sleeping. I'm Dr. Amy with Physical Therapy for Everybody, and here we are really focused on helping people to live active, healthy, and confident lifestyles without needing medication or even needing to consider surgery. So, what can you do today? And I promise you these tips are all available to you right now to do today to be able to decrease your back pain while you're sleeping. All right, so the first one is going to sound potentially a little counterintuitive, but the first thing you need to do is to move during the day. I got confused because I was thinking about sleeping. I need you to move during the day. Now, here's the thing. Our low backs, when they get tight and cranky and crabby, right, it makes us want to sit and you just feel it. You don't feel good. You don't want to be up and moving around. This is the wrong thing to do. We've got to keep moving because the movement is life. The movement is what brings nutrition to all the different tissues in our body. So you've got to keep moving during the day. Now, I understand you may say, well, if I try to do this, it hurts, or if I try to do that, it hurts. So yes, please avoid movements that are painful. Okay, so that would be on the don't list. We don't want to do movements that are painful. But as much as we can move throughout the day pain-free, we want to keep moving throughout the day. Because what happens is that then it gets everything moving around a little bit better. So when we're more sedentary, because you're sleeping, right, and you shouldn't be getting up all the time when you're sleeping, it allows your body to still be able to keep things moving, get good blood flow, and allow everything to heal. Because of course, when you're sleeping is when you're healing. So it's really important to get that quality sleep during the night. The next thing I'm gonna have you do is stretch before you go to bed. And I mean like right before you go to bed, within 30 minutes before going to bed, maybe before you start your nighttime routine, I want you to do some gentle stretches. Now you can stretch your low back, you can stretch your hips in general. That's gonna feel really, really good for people without putting stress through your low back. But get things moving around a little bit so that you don't get into bed tight and sore and painful, because of course, then when you're in one position all night, that's only gonna get that much worse. What stretches should you do? I'm sure you know the answer now. You do the ones that are pain-free. Don't do anything that's painful, only move in directions that are pain-free. So with my really, really painful low back patients who sometimes it's so bad you literally can't do anything because it hurts so much. For them, I have them do hip stretches. You can stretch your hamstrings, your quads. You can do a figure 4 stretch to stretch your butt muscles. Anything that helps relieve stress in that area, because all of those muscles, most of them go across the low back too, will help the low back as well. Now, while you're doing your stretches, I need you to focus on number 3, which is de-stressing your mind. Friends, if you are watching news or social media or even working right up until the time you go to bed, and yes, I admit I'm speaking to myself here because I am super guilty of that. But if you have a lot of stress or a lot of thoughts even just going through your mind about what you need to do the next day or anything like that, it's going to make it more difficult to sleep, right? Your brain's going 100 miles an hour. It's hard for your body to shut down, and harder still, obviously, if you have pain. So again, that nighttime routine is super important. Doing some stretches, if it's brushing your teeth, flossing, washing your face, these things are important to do to have time to let your mind slow down. If you have a long list of things that you need to do and it keeps running through your head while you're trying to sleep, then I recommend people write things down. So that's what I've started to do. On nights when I work, I go home and I do write my notes and everything. Before I turn off my computer, I write down a list of things I need to get done the next day. That way it's sitting there waiting for me in the morning when I get up, and I don't have to be thinking about it all night long. Or even send an email at 10 o'clock at night if that's what you need to do to remind someone to remind you, which is also what I do a lot, that something needs to get done the next day. But get it off your plate, get it out of your mind, and de-stress your mind. Don't be watching news and controversial things right before bed, because it's just going to keep your mind spun up and make it harder for your body to rest. Now, number 4 is we need to decrease that low back pain, and I don't want you to have to use painkillers in order to do that. So my favorite tool for decreasing low back pain without painkillers is ice. I know, you may not like ice, and you may say, Dr. Amy, I am not going to use ice because I do not like it. But if you have really bad pain, have you tried icing recently? It is the most powerful pain inhibitor, which means it decreases your pain so much. Now, here's the thing. This is the compromise I make with everybody. The research shows you only need to ice for 3 to 5 minutes. That is going to give you the maximum pain inhibition, which is eliminating your pain, after 3 to 5 minutes. You don't have to ice for 20 minutes. Now, if you love icing and you think it feels fantastic and it gives you an excuse to sit for 20 minutes, go ahead. Feel free to ice for 20 minutes. I have no problem with that. But the research clearly indicates you only need to ice for 3 to 5 minutes to decrease your pain. Now again, going back into that evening schedule, for a lot of patients, I will have them do some icing, some stretching. We'll do some deep breathing and some relaxation along with that. Have them get ready for bed and go to bed. That can take you from 15 to 30 minutes and is a nice way to just kind of settle and tell your body, hey, it's time to go to sleep now. It can actually improve the quality of your sleep as well. Tip number 5 is to sleep in the best position for your body. Now, if you have low back pain, what is the best position for you? This one's a little complicated because the best position for you is the one that you can fall asleep in. So I try not to tell people they have to sleep on their back or they have to sleep on their side, because if you can't fall asleep on your back, then that's not really the best position for you, is it? However, in general, for low back pain, sleeping on your back is the best position, but I need you to put some pillows underneath your knees so your knees are bent a little bit, because this will help to take some stress off of your low back. Lying flat down causes you to kind of arch your back, and although it may feel good when you lay down initially, it's not going to feel good when you wake up in the morning, because that really closes down everything in the back and actually decreases the blood flow, which can increase the pain. So if you're laying on your back, I need you to put some pillows underneath your knees so your knees are just slightly bent but still supported, obviously, because you're going to be sleeping here soon. It is preferable, if you can, to sleep on your side. Now, make sure, that you have a pillow that fills in this hole right here, okay, in between your head and your shoulder, so that you're not causing any neck problems or anything like that. And ladies, because our hips are wider than our knees, I definitely recommend putting a pillow in between your knees. Now, gentlemen, it's not a bad idea for you guys either to put a pillow in between your knees. Now, I will tell you that often people are like, oh, but I wake up and the pillow isn't in between my knees. That's okay. That's all right. If you start off in a good position, it's still better than starting off in a bad position, right? You're still going to get a couple hours with that pillow in between your knees. If you throw it out in the middle of the night, you throw it out in the middle of the night. Again, the important thing is you need to be sleeping. If you're not sleeping, you're not healing, okay? So try putting a pillow between your knees when you fall asleep if you're a side sleeper. And if you throw it out, that's okay. If you wake up enough, you can go grab it and put it back in. But don't worry about it. Just start with it. Now, my friends with low back pain, the one thing I do need to ask you not to do, the big don't, please hear me on this, is sleep on your stomach. When you are sleeping on your stomach, you are putting way forces and pressure on your low back. It is not a good position. It's also torques your neck and can cause a lot of neck problems. So it's not a great idea for your neck either, but definitely not a good position for your low back. However, that being said, If you have to sleep on your stomach because you're like, that's the only way I can fall asleep, and Dr. Amy, you just said that sleeping is really important because that's what I'm healing, here's what I'm going to ask you to do. I'm going to ask you to put a couple pillows underneath your stomach. It'll cause your back to be in a slightly arched position. We don't want a huge arch in your back, but a little bit of an arch so that it opens up everything in the back. It opens up the muscles, the fascia, the ligaments, the joints, so you don't have that compression while you're sleeping. All right, which tip was your favorite? Or what other things have you tried to improve your sleeping with low back pain? Drop a comment below because we love to hear what you guys are using and implementing today. Have a great day, everyone.